In today's topic GERD. GERD is considered as gastroesophageal reflux disease. Most of the time the people comes with all symptoms suggestive of burning sensation in the chest and coming to the throat and sourish feeling or acidity feeling. These are all the symptoms of GERD. Medically we call as gastroesophageal reflux disease. So it is a reflux of stomach content which is acidic into the esophagus, sometimes into the throat. So usually the causes for GERD is commonly seen in obese patient where the lower end of the esophagus, like what we call food pipe, there's a sphincter mechanism that allows one-way flow of the food contents from above to down. But if there's a loose, if the sphincter is little loose, then the stomach content can return back to the esophagus. This leads to the symptoms. Symptomatically, they present with chest pain, and some people will present with burning sensation, some people present with throat pain, some people may present with loss of enamel. So these are the various symptoms of GERD. So usually the cause of GERD is most commonly seen in obese patient, and also it's commonly seen in pregnant women. 30 to 40% of the pregnant women will experience GERD due to pressure in the abdomen, and also commonly seen in the food, like we consume more food like peppermint and some chocolates, spicy food, fatty food, non-vegetarian food, sometimes tomato sauce, and few patients, the smokers are also at increased risk of development of this GERD. So other issues like the patient who are on certain drugs like aspirin and NSAIDs like painkillers, they're also more prone for GERD. Then with regards to the adverse effect, what does GERD leads to? In a long term chronic GERD, if the patient suffer from longer duration of the symptoms, they end up with development of scarring in the lower esophagus, we call as stricture. So it gives rise to difficulty in swallowing food. Then secondly, it can give rise to ulcer formation. Sometimes ulcer can give rise to bleeding. And very rarely, if the patient have long history of GERD, they end up with Barrett's esophagus, where the scarring can further give rise to progression. And Barrett's esophagus is a precursor for development of malignancy, like cancer. So this warrants every individual with features suggestive of GERD require medical attention and should meet the gastroenterologist for further management. Regarding the advice, normally doctor will give advice like lifestyle changes and dietary changes. This is more important than the medicines. Regarding the lifestyle changes, losing weight, definitely 5 to 10% will reduce the GERD symptoms. Along with the losing weight, patient also should avoid certain foodstuffs, like as I already said, like more like spicy foods and soda, alcoholic, and stop smoking, and also avoid peppermint, and also avoid chocolate and other foods. And also they should take a lesser quantity of food, more frequent portions, like rather than taking 3 meals a day, they can have 4-5 meals a day with a smaller quantity. And third most important point is, once they have food, especially the night meal, should be less quantity, and they should take minimum 2 to 3 hours gap between the night meal and the sleep. And whenever these patients experience regurgitation, they should elevate their head while sleeping. So these are the precautions we give to the GERD patient. Along with this, we also tell if the symptoms persist for longer duration, we advise them to meet the gastroenterologist and should undergo endoscopy just to risk stratify them, what category they belong to. And then the gastroenterologist will put you on medication to suppress the acid and also improve the motility of the food content in the stomach.